And welcome back. Norma in Montgomery, Alabama. Hey, Norma, thanks for watching us on Free Speech TV on the Dish Network. What's on your mind today?
Hi, Dr. Tom. I had tried to talk to Alex on Monday, and I had to give up. I had been listening to this stuff about Social Security and Medicare, and they're in there today talking to the person who's going to be in charge of human health services. And I still think that what Bernie is saying is Medicare for all is best. And I don't think that anybody really understands that if we go back to what we've had, that people are going to be suffering.
Well, according to Harvard University, 45,000 Americans were dying every year.
Yes. And say like right now, my neighbor has lung cancer. They told him that the drug he needs is experimental and it's not covered, and it's $18,000 a dose if he wants it. And so he came home. That's all he's doing.
Wow.
This isn't the kind of thing we need. Also, here in Montgomery, we've had all these people die from active live cases of TB. There is no insurance in that area at all.
Where is this?
It's on the west side of Alabama.
Wow.
And they were actually paying people $20 to show up and get tested for TB.
Wow.
What you don't understand
That's
is
a public health crisis. I mean, that goes beyond just individual cases like the lung cancer. This TB is not only contagious, but, I mean, TB epidemics used to ravage the world.
That is my point. And people need to remember that if you live in a rural area and there's no health care, there's probably not any jobs either. So where do they go to work every day? People move around. You cannot have someone driving from a rural area with no health care, no doctor, and come in and particularly work in the health industry. I mean, in the food industry. You just cannot have it because you don't know who put your salad in front of you. And I would like for you to, they were trying to get, Bernie put in a law trying to get the right for Medicaid and Medicare to negotiate for these drugs. Mm-hmm. And there's a list out there of people who voted against it. But the next time he has a bill coming up, if he could come back to the show and let us know he's got a bill coming, then we, who actually have a clue what's going on, could help him, and we could get something done. But if we don't have health care for everybody is at risk. I don't care where you live, you're at risk.
Yeah, this is a national security issue. In the event of any kind of biological attack, this is a national health issue. And of course, it's an individual right to life, liberty, and the pursuit of happiness issue.
Yes, it is. But like I said, if you go out to eat and you don't even know what goes on in the kitchen and somebody puts food in front of you, is it even safe to eat it?
Right. And what if it need not even be the cook. I mean, the lowest paid people are very often the people who are bringing the food out and putting it on your plate. They're also the people who are washing the dishes in many restaurants. And if they're the lowest paid people, they may be the most likely to be having active cases of tuberculosis.
Well, you know that a waitress gets paid, what, $2.35 an hour?
Right, plus tips.
They cannot pay for health care.
Yeah.
And there's just no way it's going to happen. And we have people here who pay the fine every year because it's cheaper. I have a neighbor who's a teacher. She has Blue Cross through the state. Her deductible is $2,500.
Yeah.
She's already forked it out $400 a month. And she can't even go to the doctor until she forks out the $2,500 a month.
That's amazing. I mean, that's terrible. Norma, thank you so much. You really put your finger on it. Thank you. It's 21 minutes past the hour.